Consultative speech styles. The consultative speech styles is considered to be the most operation style among other styles. It uses semi-formal situation in which a speaker needs to provide background information because the listener or the addressee may not be able to understand the topic without.
For example, in a discussion between an insurance agent and a prospective client, the agent needs to provide the client with a background information regarding the company's types of insurance, policies, and the benefits each provides. In turn, the listener participates by giving feedback. Thus, both the speaker and the listener are active participants.
Characteristic of consultative speech style. The following are the characteristic consultative speech style. First characteristic of consultative speech style is it can use an ordinary route transaction that lead to an outcome or result. The best for example for this is your teacher lecturing and the student asks a question about the topic and then the teacher will explain the student what was asking about. The next is business or other professional situation. For example, a conversation between a teacher and a student, a doctor and a patient, and lastly, a lawyer and a client. So in consultative speech style, interruptions are allowed. For example, you understand the topic and you will respond like, I see, or a sign that you are paying attention to the speaker. The next is the titles that you're going to address the professional person that you are talking with. Example of these are Mr., Miss, or a doctor or a teacher. Lastly, choose word with some respect and consultative speech style. You have to choose a semi-formal conversation to show respect and the flow of your conversation is professional and authentic.
Style is also used when being introduced to someone for the first time or conversing with a stranger. Situation. The patient is consulting with a pulmonologist. Patient. Good morning, Dr. Gomez. Dr. Gomez. Hi, how have you been feeling? Patient. My cough has been getting worse since last week. It stayed with a dry cough. Dr. Gomez. Do you have any history of asthma? Patient. Yes. Doc. I was also diagnosed with a primary complex 2 years ago.